What I want to talk about today is advanced care planning. And advanced care planning is kind of what the name says, is planning in advance. Kind of like this note that my wife left for me in my pocket, and it says, "When you get home, if I'm not there, please take the chicken out of the freezer, set the oven to 350, and put the dirty clothes in the washer, but do not put my blue sweater in the dryer." So it's a good thing she left the note. How would I have known not to put the blue sweater in the dryer? Our healthcare is kind of like that too. So what happens is advanced care planning is in advance making plans for what you want done with your healthcare should something happen and you can no longer make those decisions. And advanced care planning falls into several categories. One way to do it is what's called a power of attorney. A power of attorney is when you say, I'm not sure what I want, but I know my brother Jim or my wife or whoever, they really know my wishes, and that's who I want making decisions for me. So a power of attorney gives the authority to someone else to make those decisions for you. Again, you're still in control, but you're relinquishing that authority to someone else. The second way to do it is with what's called a living will, and each state has a different living will. It says essentially that if something happens to you, you do or do not want certain life-sustaining treatments. The typical life-sustaining treatments we talk about fall into resuming the heart and breathing, so CPR and a breathing machine to keep you alive, and then tube feedings or artificial nutrition and hydration to keep you alive should something happen and you can no longer do that. So if you have strong feelings that if something happened you would or would not want those things done, then the living will is what you need to fill out. Another kind of document is called La Poste. It is a order that a physician signs about your wishes. So keep in mind that the living will is simply your wishes. It's not a physician order. And so EMS or some other group coming to your house to take care of you in the emergency room, they're not sure what really should be done. They don't have an order from a physician, and the default policy is to do everything we can to keep people alive. Again, there may be some circumstances where you would not want to be brought back should something happen, particularly people with terminal cancer or other illnesses like that. The La Poste document is perfect for that. There are other documents that can be used, and one you can get online is called 5 Wishes, and it goes through, if things happen to you, what you would want done. The important part of all this is that you plan ahead, advanced care planning, and that you do 2 things. One, your family needs to know. So it really doesn't do a lot of good to write something out and then not tell your family, because if something happens to you, your family's the first people we go to say, what do you think your mother, father, brother would want? The second thing is your doctor should know. So we do ask if you make one of these documents out that you bring a copy to your physician and let them keep it in your medical records.